Today in this lecture, we are going to discuss the steps involved in the counter-current multiplier mechanisms. This is a very simple and easy topic and you will understand it. There are 6 important steps which get repeated and it leads to the counter-current multiplier mechanisms. First of all, what is the purpose of this counter-current multiplier mechanism? The purpose of this mechanism, this counter-current mechanism, is to keep the medullary interstitium hyperosmotic. The osmolarity of the interstitium of the medulla is high. The osmolarity in the medulla is high as compared to the cortex, and this thing is achieved by countercurrent multiplier mechanism. Now there are a lot of things, things to discuss, but today we will especially focus on the loop of Henle, the ascending and descending limbs of loop of Henle and their role in the countercurrent multiplier mechanisms. In the coming lectures, we will discuss the other things, the other segments of the nephrons which also play in maintenance of the countercurrent multiplier mechanisms. Now coming to this loop of Henle, this is the loop of Henle. Before we go into detail, let me remind you that whenever fluid enters into the kidney, it is filtrated in the filtration occur in the glomerulus. Then this is the fluid filtrate comes into the proximal tubule, then the descending limb of loop of Henle, then the thin ascending limb of loop of Henle, then the thick ascending limb of loop of Henle, then the distal convoluted tubule, then cortical collecting ducts, and finally medullary collecting ducts, and then in the form of urine out of the body. Now this is the usual mechanism, and this simple thing has been explained so many times with reference to different topics and different actions of different hormones which act on different parts of the nephron. Now let's come to the countercurrent multiplier mechanism. And to understand the countercurrent multiplier mechanisms, we need to understand few basic things. One of the most important thing is that the descending limb of the loop of Henle, it allows the reabsorption of water. So it is permeable to the water. Water can move out of this tubule, this descending limb, into the interstitium. Then another important thing is that the ascending limb, the thin ascending and the thick ascending limb of the loop of Henle are waterproof. They are waterproof. Water cannot move out from the thin ascending and thick ascending limb of the loop of Henle. It cannot come here. But it is permeable to electrolytes like sodium chloride and other electrolytes, and also active transport of electrolytes from the tubule into the interstitium occurs in the thick ascending limb of the loop of Henle, also somewhat in the thin ascending limb of loop of Henle. Then finally, another important thing is that the active transport of the thick ascending limb of the loop of Henle is capable of maintaining a difference of only 200. A difference of only 200. Milliosmoles. Suppose, for example, if the osmolarity of this region is 500, now the osmolarity of this fluid inside the tubule can be maximum 300. Now if it is 600, then it can be 400. Or the other way around, if the osmolarity of this region is 400, then the osmolarity of the medullary interstitium can be maximum 600. It cannot go beyond 600. Now 200 is the concentrating ability of this segment, and this is going to be important. Now let's come to the details of the countercurrent multiplier mechanism. Here we have the loop of Henle. What happens in the loop of Henle is this is the step 1. In the step 1, fluid enters into the descending limb of the loop of Henle, and then it moves into the ascending limb of the loop of Henle. It simply moves around from the ascending into the descending, and during this movement, water is reabsorbed from the ascending limb and solutes are reabsorbed from the water is reabsorbed from the descending limb, as well as electrolytes are reabsorbed from the descending limb. But when it comes to the ascending limb of the loop of Henle, only solute is actively secreted. Only electrolytes like sodium chloride are actively secreted from the tubules into the interstitium. As we discussed that this segment, this is the waterproof segment. Water cannot move, so only electrolytes are moved out. Now another very important thing which we discussed is that it throws out sufficient electrolytes to make a difference of 200. Now it has actively transported sufficient electrolytes from this thick segment into the interstitium that the difference between the osmolarity of these two areas is 200. Here the osmolarity has increased to 400 400, 400, and here the osmolarity has decreased to 200, 200, 200 because of the active transport of ions, especially sodium chloride ions. Now, this was the step 2. What happens next is this descending limb is permeable to water. So water quickly moves here. Water quickly moves here because water always moves from an area of low concentration towards an area of high concentration of solute. So water quickly moves out, and the concentration on both sides the interstitium and the descending limb become equalized, and this is the step 3. Now you can consider the medullary interstitium, the concentration in the medullary interstitium and the descending limb as twin sisters. These are the concentration between these two is behaving like twin sister. They always behave the same. So as soon as the concentration here has increased to 400, this descending limb has responded by increasing its concentration to 400. So it has quickly responded and it has equalized its concentration with the medullary interstitium. So what happens that initially the concentration of the fluid that started to enter from the glomerulus into the descending limb was 300. Now it has slowly increased to 400. In step 4, what happens is that this fluid with high concentration of 400 starts moving into the ascending limb. It starts moving into the ascending limb, and the concentration here has increased further. Now again the active transport of electrolytes starts, and it starts throwing out electrolytes from this segment into the medullary interstitium until and unless the difference of 400 has been created again. So here is the step 5. Here is the step 5 in step 4 and 5, in which this high concentration fluid has entered into the ascending limb, and now the active transport of electrolyte has again created a difference of 200, a difference of 200 milliosmol between medullary interstitium and ascending limb. So now what happened, that the concentration here has increased to 500 and it has decreased to 300. Initially we saw when the concentration here was 300, so when a difference of 200 was created, it remained 200 and it became 400. Now this 400 moved into the descending limb because of the permeability of water in this segment, and the concentration in the twin sisters became equalized, and now this fluid of high concentration here entered the ascending limb, and again the active transport started equalizing this concentration by actively and increasing it until and unless a difference of 200 is created. But this 200 is the maximum difference, because when the concentration between these two sides increases more than 200, what happens is that after a difference of more than 200, there is paracellular movement of electrolytes back into the thick ascending limb. There is backward movement after 200. So then it is compensating any further movement of electrolytes from the ascending limb into the medullary interstitium. So that's why 200 is the limit. Now this water starts moving again, and the concentration of the twin sisters has equalized once again. Concentration in the descending limb as well as the concentration in the medullary interstitium has equalized again, and now the concentration in the descending limb has increased to 500. Starting with 300, it increased to 400 by equalizing with the medullary interstitium. Now it has increased to 500 by equalizing with the concentration of the medullary interstitium. What happens next is that now this 500 will move into the ascending limb, and again what will happen that when a concentration of 200 difference between 200 milliosmol difference between the ascending limb and the medullary interstitium will be created. This cycle will keep on repeating until and unless the medullary interstitium osmolarity has increased to around 1200 to 1400 milliosmol. So that's all about the steps of the countercurrent multiplier mechanisms, and it's very easy. If you want to understand it, you can watch it a few times and you will clearly understand, and you must know a few steps only. And the steps are that this portion, the ascending portion, is waterproof. It will not allow the movement of water. The descending limb will allow the permeability of water, and the difference between the medullary interstitium and the ascending limb can only be 200 milliosmol. And whenever there is increase in medullary interstitium osmolarity, it will quickly equalize this concentration with the concentration in the descending limb. Now there are other things which are playing a role in keeping the medullary interstitium osmolarity very high, and slowly and gradually we will discuss all the relevant things in the coming lectures. That's all about the steps of the counter current multiplier mechanism. Thanks a lot for watching the video.